Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on this Wednesday, October the 19th. Good to have you with us today. Well, you know, I was looking through my AARP bulletin. Yes, I'm old enough to have AARP. And I saw a story in here under Your Health. It says Jaw-Dropping Breakthroughs in Dentistry. And I immediately thought of Dr. Philip Batson and Elizabeth Abe from Columbia Healthy Smiles. And I thought, I'd like to just talk to you about some of these, and they have it, jaw-dropping breakthroughs in dentistry.
I'm glad you thought about me.
Yeah, and this was in AARP. The first thing that and it's a good article. It talks about less expensive implants. Now, what do they mean by less expensive implants?
So in that first part of the article...
You read the whole article.
I took a look through it, yeah, and it is a nice read, and they have some good information in there. And that first part with the less expensive is that they were talking about patients who maybe already have a denture or already missing all of their teeth, and they're looking for a more secure way to hold on to their dentures, and that can be with what we call dentures that are retained with implants. Mm-hmm. And so instead of having a mouthful of implants, you know, an individual implant for each tooth, which would be a very high, very expensive, and not something that you really see too often, they can attach dentures to implants from anywhere, onto 4 implants, sometimes as little as 2 implants on the lower jaw. But that can be fixed into the mouth. Then usually, if it's fixed, it's going to be at least 4 implants, either if it's upper or lower jaw.
So what you're saying then is it's the same as having dentures, but you don't take these dentures out. They are permanently screwed in. So they're not being held by suction like regular dentures are.
Exactly. No adhesives, none of that.
So you never take them out.
Nope. If it's a fixed denture like this, where we call it a fixed prosthesis, you would actually see your dentist about, kind of like you do for your checkups, every 6 to 12 months, for them to actually take it out, check your gum health, clean the denture, clean around the implant parts to make sure that that stuff's not building up underneath of it.
Now, if they take these out, mm-hmm. Are they screwing them out of your mouth?
So they take the denture out of the mouth. The implants are actually fixed below the gum line in the bone. Those don't come out. Those are like, I refer to them as man-made roots. So they would be titanium roots that have actually integrated with your bone. And so those aren't coming in and out. Just the dentures. And so there is a screw channel that then you can take a screw out and take the denture out and do the cleaning.
It doesn't hurt?
Nope, not at all. Nope.
Okay, so this would be for people, and in this article, which surprised me, it said that 14% of people 65 years of age or older have lost all of their teeth. Now, isn't that a pretty high percentage of people 65 and over who have lost their teeth?
That is very high percentage, especially for all of their teeth, and so... dentures, we always talk about it, and when we talk to patients about dentures, if they ask us about pulling all of their teeth, if they, we always say that, a traditional denture where that is not attached to implants, that is just solely relying on your jaw anatomy to stay in, those are a reduced chewing function of about 80% from your natural teeth. So we tell people, if you go from whatever you're at now, chewing function-wise, you will drop by 80% in traditional dentures. And I was telling them, dentures are a replacement for your missing teeth. They are not replacement teeth. You will not chew the same way with them.
But if you have the dentures that are screwed in, that are permanent, do you have the same chewing power as you have with your original teeth?
It increases substantially. I can't say
but
that
it's still not
I can't
the same.
Say it's pretty close to the same. Especially if a lot of patients who, when they're coming to a state where they're at the point where they need to pull all their teeth, or the option is pulling all their teeth, a lot of times the mouth health, overall health, isn't at a tip-top shape. And so getting them into a fixed denture is worlds better than what they were even chewing on with their existing natural teeth, because a lot of times their oral health has gotten to the point where they need their teeth pulled, unfortunately.
Now, I've heard people say that their dentist has told them they cannot wear dentures because their jaw is not strong enough, or they can't have those posts put in because their jaw isn't strong enough. With that permanent denture, can anybody have that done, even if your jaw is not strong enough?
You have to be a candidate for an implant first. So you have to have enough bone to put an implant in. You have to have, so implants come all in different sizes, but you have to have the right anatomy. So sometimes the jaw, and this article talked about it too, the jawbone has to be augmented or maybe increased with some grafting, bone addition, to get somebody available to be able to have an implant placed. And so if a fixed option's not available, there are implant options for dentures where you take the denture out still, but your retention is so much more increased because they're they're either with a friction grip going into it, or like a, lack of a better term, like a suction cup going into it that can really click on and off and really give patients a huge improvement in chewing and function. Even if it's not fixed, it's still removable. It's still great.
Okay. All right. The best thing to do is have all your teeth.
Absolutely.
But that's one option, is the implant. Then what about 3D printed dentures?
Yeah.
What are those?
So 3D printing is really coming into the forefront in dentistry. It's like the next technological kind of advancement. And one of the first places they're really doing a lot of cool stuff is with 3D printed dentures. They're stronger than traditional dentures. They fit better. We've started using 3D printed ones with labs. Well, we don't print it in our office. We use labs that use the 3D printing technology. It's really neat. It's kind of where things are going, and a lot of dental applications are with the 3D printers. And so that's an exciting technology. And you can do a lot of other stuff with 3D printing in dentistry as well.
And we're out of time, just about out of time here, but computerized mouth mapping, that's something that's important, isn't it?
Yeah. So a lot of times that'll be referred to as a CBCT, and what it can do is take a 3D image of your jaw. And like what we do at our office when we take one of those is we can see extra anatomy. We can check to see if somebody could be a candidate for implants. We're also able to check teeth that might have infection or need a root canal. We can see the canals in the tooth. We can check for fractures. It also helps us look for pathology that maybe we couldn't see on traditional x-rays. It's a really neat technology.
Yeah, if you want more information, well, you can give them a call, Columbia Healthy Smiles, or check it out on the web. Your phone number is?
573-875-7071.
Okay, thank you, Philip. Always a pleasure to have you. And the story I was reading on, it's in the September AARP Bulletin, if you get that, or I'm sure you can look it up online.
It was easy to Google.
Really an interesting thing about dental work.
Yeah.
All right, something you'd like to hear or see, I'd love to hear from you. Drop me an email, pepperp@missouri.edu. Bye-bye.